Good afternoon, everyone, and welcome to today's session presented by Guidehouse on managing your revenue cycle's response to COVID-19. My name is Rebecca, and I will be the moderator on today's webinar. Our presenters will introduce themselves in just a bit. A few housekeeping items. Please note that all lines have been placed on mute to prevent any background noise. A recorded version of this webinar will be made available to all those who have registered. You will receive a link in your inbox. We would love to hear from you. If you would like to ask a question, you may do so via the Q&A feature in your GoToWebinar dashboard. Once our speakers have concluded, we will compile the Q&A roster. I will now turn the call over to Mr. Tim Kinney. Go ahead, Tim.
Thank you, Rebecca. Hello, everybody. My name is Tim Kinney. I am a partner within our revenue cycle practice here at Guidehouse, and wanted to first and foremost thank you all for your time today, and thank you for your continued hard work within the revenue cycle across the country. Welcome to our 5th episode of Managing Your Revenue Cycle Through COVID-19. Today, we're really going to start focusing on the solutions that are intended to help us restore not only our revenue cycle operations, but also operations across the hospital, and align to what we are seeing as a new operating model that has emerged as we head into month 3 of COVID-19. So I'm joined today by a team of revenue cycle experts. This team is working with hospitals, physician groups, and health systems across the country to address a lot of the same issues that you guys are seeing day in and day out. So our intent is to be tactical. Our intent is to talk about the work that we are doing specifically across the country, the issues we are facing, the challenges we are facing, and then ultimately how we're overcoming those to drive results and continued momentum as we look to pick up here. Rebecca, if you don't mind going to the next slide. Brief overview of what we're going to focus on today. We're going to talk kind of in the premise of every system, large, small, rural, urban, whatever the case may be, is facing a revenue shortfall, increased expenses due to the pandemic. And we have done a lot of work in sizing that gap for the future. Some of that will be filled through the funding mechanisms that are out there in the marketplace via the federal government, the CARES Act, FEMA, etc. And then some of it is going to be increased margin pressure and the need to get solutions out there to decrease expense, increase revenue, and make sure that we're collecting every dollar within the revenue cycle that we potentially can. So we'll hit on the following today. We'll hit on virtual and telehealth. I think nothing new here. This is really the new normal, but we'll talk to a couple of the experts in our team that are actually setting these up across the country, looking at the technical setup, looking at the process setup, etc. And then we'll talk about the virtual business office of today and planning for the volume surge, how to manage your business office. And then we'll talk about the access strategy and contact center. Recently read an article post, 78% of people fear actually coming back into the hospital. So the ramp up might be slower than anticipated, and some of the original models showed. So how do we begin to pull the patients back in through effective reach out, effective marketing, etc. And then we'll turn over to Scott. He's going to spend some time talking about the EHR technology, how we can optimize our workflow to make sure that we're tracking productivity, we're tracking quality, using workflow to drive operational outcome. Spend a little bit of time talking about partnerships. I think they can be as very important, if not more important right now, in terms of every organization looking to move to more of a variable cost structure. You have partners that do things very well, and you can leverage them and go up and down as volume does the same pre and post COVID. And then we'll talk about margin improvement as well. We need to make sure that we continue to have pressure on that, the day-to-day and what we do. Read another interesting article where 45% of coverages for people have changed. So whether that's the increase in Medicaid enrollment, shift to self-pay, whatever the case may be. So we have to get ready as a revenue cycle team to make sure we're protecting that margin. There's going to be some front-end work, middle revenue cycle work with the complexities of coding and billing for So as a reminder, we'll have this deck up onto our website. We'll make sure we distribute it as well to everybody. At the end, we'll make some time for question and answer and make sure we're getting back to people if we don't have the exact answer today. Lastly, I would just ask for your patience as I turn it over to Brian. We know that the platform is under a lot of stress and pressure with everybody moving to the virtual environment. So if we happen to go in or out, we'll get back with you as soon as possible. With that said, I'll turn it over to my colleague, Brian Chamberlain. Thank you.
Thanks, Tim, and welcome everyone. Really starting off to just talk about, as Tim mentioned, all of us and you guys, particularly in the revenue cycle space that are operators, are being asked to do a lot and adapt to this. Certainly, it's not the traditional frontline what people expect, but folks in the business office are having to support all of the changes that are a result of COVID-19 and the organizational impacts that they've had. So we know that there's been tremendous changes in just the operating models of folks having to go remote, everyone's scrambling to follow a business continuity plan, or in some cases develop one. A lot of our clients had stuff that was out there but never really was needed, and had to dust it off in short order and work with their HR and IT partners to internally to make everything happen, to move as many people remote as possible and make sure that all of their connections and integration with either vendors or other IT platforms worked, and how could you manage that workflow in a remote capacity. So certainly I think this essential tasks are probably a bit understated. I mean, that was a huge undertaking. We've seen clients do it. At the end of the day, I think really posed a challenge, but everybody rose to the occasion that we've seen and we've worked with and completed it, right? It kind of goes to the, like everyone else, the ability to adapt under these immense circumstances has been pretty impressive. So, what the next phase though is, how do we get back to the normal? What does that look like? And with that, it is going to be adjustments. As Tim mentioned, there's a likely surge as elective procedures get ramped back up and patient volumes go back to, a little bit more of a normal. There's probably going to be, and what we started to see already is service mix changes, but that's going to require revenue cycles to adapt and adjust. So we've seen everything from remote working to potentially furloughs. How do we then create the workflow adjustments or the staff modeling to come back to that new normal environment and support the revenue cycle functions that are going to be required with that return to baseline, if you will? One example that we've seen helped clients work with or do is to define not only a staff model, but just a training platform or expectations on how to get remote workforce doing what had been traditionally billing functions. The volumes have gone down, the number of billing edits, the number of bill reviews has dwindled a bit, but now as the scheduling picks back up, it's either moving to scheduling procedures and supporting those functions, particularly looking at things that were deferred and getting those visits, either proactively reaching back out to the patients or reviewing the pre-financial clearance functions. So all those authorizations, are they still active? Do they need to be reviewed and reauthorized by the payers? So really kind of understanding what that plan is and putting in place the staff projections and the training plans to be able to support that. And that kind of speaks to what Tim mentioned a little bit or touched on, is just the ability to be flexible and have scalability in the revenue cycle. So this is particularly one that we look at, is just how do we minimize those backlogs, and it is very much kind of a back to basics, but using this opportunity to review the overall revenue cycle operations and being able to plan and accommodate to changes over what we anticipate the next 3 to 4 months, and then beyond that, if there's unanticipated changes or that time frame gets significantly delayed. The second piece of this is just the people, right? The operations component is key, but how do we support the folks that are on the front lines in the revenue cycle and all the activities that they're performing in this remote capacity? And in some cases, I mentioned doing other tasks that they may not be experts at, right? They probably have a general awareness, of course, but somebody who's really day in and day out doing billing edits, maybe they're not as well versed in the authorization requirements of certain payers. So those functions of understanding what challenges they have and asking questions of the teams. So putting out their surveys or acknowledging what types of fixes on the IT front or what training supplements they need. Of course, the workflow adjustments all come in parallel with all that. And then the last piece of this is the vendor support, and how do we evaluate either our existing vendor set, or potentially this time is an opportunity to understand where we could have a additional vendor supplementation. So are your vendors performing well? Of course, you want to look at that. Were they able to scale and adjust as needed in this environment? And then are they set up to do that successfully in the future? This is a great opportunity to be able to stress test that relationship, if you will. So next slide on a checklist here, really just, some fundamentals, the business continuity plan, of course, this is a great opportunity to update that and aligning this not only in the process front, but of course the mapping it into any IT or disaster recovery that the IT teams may have in place. Of course, the tried and true KPIs. Everybody, I think, is very focused on what their historical KPIs and the long-term KPIs have been, but how do those change in the short term? I mean, we all think about cash projections, and cash expectations are going to be much different over the next 3 to 5 months as the slowdown starts to emerge, and then the revamp of elective procedures kicks back up. There's going to be a lot of variability in that, and really understanding what the modeling looks like and how do we set the appropriate KPIs in that shorter midterm duration. The staffing plans that I mentioned, and I'm sure you all are focusing on this, we're helping clients kind of review this and looking at opportunities to not only make it the right size and have scalability or flexibility in the future, but as we all know, organizations are challenged financially, and they're looking at opportunities to minimize some of the costs. So are there opportunities for longer term staff efficiencies, and or, I mentioned the vendor placement, how can we provide a scalability into that and maybe move from a fixed to a variable scenario? So helping to analyze that, and may not be something you put in place immediately, but it has to be completed as we move back into the new normal, if you will. And then I think the last piece here is just the contingency models. There's all of this stuff that we're talking about today is nobody really knows exactly what the next 3 to 5 months is going to look like. Certainly we have an idea, but there could be a very different model. It could be a quick ramp up to normal. It could be a slow and gradual, which we're kind of anticipating. It could be a slow and gradual, and then all of a sudden there's another wave of COVID cases, and we have to go back to really enact that business continuity plan and go back to an environment that we saw in mid-March. So understanding what the KPIs are, what the targets are, and taking the time to evaluate some of the basics is really key here. So next slide. How does this all translate to improving the financials for the organization? So we think about margin improvement. Most of the CFOs and most of the organization is going to look to the revenue cycle, as you all know, and how to then help with overall net revenue. And of course, they have the goals and the targets for cash. Like I said, those things are likely changing. The other aspects here, though, are what either traditional or non-traditional activities can we put in place that are going to help support the financial challenges that the providers are experiencing today. So you think about ways to boost revenue. Again, I think you're probably familiar with some of these is the traditional charge capture, but really making a robust expectation and rule set around the revenue reconciliation, have good reporting, have a very solid accountability structure of who is going to track that revenue. What are they going to do when it's off? I think that's the biggest question we see with our clients is folks typically look at revenue, on a couple ends of the spectrum. Some folks only look at it when it's really off budget. Some folks look at it monthly, and then at that point it may be too late to really change the recognition of that. If you're looking at a service from the first of the month on day 30, it's hard to go back and understand why was it off. And then what we see as more of a best practice is that daily accountability. And the key here is, of course, the tools and who's going to look at that. And you can do it daily, but if that person or that department does not know who to reach out to for assistance, and typically that's the revenue cycle team, the revenue integrity teams, having that process stood up and being followed on a daily basis is really key. And then the piece of this too, Scott will talk about is, the IT efficiencies. There are business rules that you can put in place in your EHRs to help identify these mischarges, charge sets, charge pairings, maybe certain areas that need to go to additional coding review. Those are all things to revisit today and make sure that we have for one, what's the process that's today? Is it still applicable? And what additions or changes do we want to make to support the revenue cycle? And then telehealth, we're going to talk about that today. You guys are all seeing that in action. But that's a big risk area that we're seeing with our clients is, performing the telehealth visits is great, but do we have the right revenue capture? Do we have the right billing components here? This is all areas that we need to really track the right revenue. And then as we get downstream in the billing, track this very detailed so we know if something is off, can we go back? We don't want this to be held up either in a collection queue or, even worse yet, in a billing queue because we're not sure how to send it out to the right payers or to the payers correctly. And then, the last thing here is just, I mentioned the rescheduling of those procedures, really focusing on that. We're seeing and helping clients move some of those back-end teams to that front-end function so they can identify areas that are rescheduled visits, and we can push those to be rescheduled as quickly as possible and fill the provider scheduling blocks so that we're maximizing the overall gross revenue. And then accelerating payments, there's been a lot of talk about the Medicare advancements, excuse me, the Medicare payment advances. We've also talked to clients and their largest contracted payers to do the same thing for some of their commercial payers and be able to maintain a revenue stream there. The insurance companies are seeing less claims. Those may be offset in the future with claim volumes increase, but they typically understand the challenges that we all as providers are experiencing. So, we've been successful in asking for and modeling out, really helping the providers to model what would be a regular payment advance. How would that look with minimal offsets or credits in the future? And we've been successful in kind of identifying, a model or a negotiation with some of those payers. And they've been, for the most part, not all, but for the most part, willing to do that. You think of, some states, and Blue Cross is pretty common where they do the PIP payments. That very same feature, same kind of methodology. But the key here is once you do that, how do we then track the offsets in the future and don't have significant credit balances associated with it? Next slide, please. Aggressive AR management, I probably won't spend a lot of time on this. I think this is the fundamentals of cash acceleration that, all of us in the revenue cycle are familiar with, but really taking a concerted effort to review the workflows for our AR teams. Think about one area that we spoke about revenue capture is just making sure that now that process, if we're enhancing the revenue capture process and maybe involving the clinical areas in that, we're not slowing down the billing process. So that's key. The flagging of COVID charges also we've helped clients with so that they're can either send those in batch or at least identify what the expected reimbursements would be. Do they have the right payers? Or they have a second level review of those coding procedures associated with those diagnoses? And then the last bullet here, number 4, the last section with authorizations, incredibly key. I've read some news around trying to enforce or lengthen the authorization timelines, and whether or not this would be a state rule or CMS of, say, a 30-day authorization being automatically extended to 90 days for those procedures that may have been deferred because of COVID-19. So whether or not that comes through, or if that's something we're even aware of, working with the payers to manage that is going to require a lot of manpower or staff at the revenue cycle team, and again, shifting those people from the back end perhaps to the front end, building out the staff plan is key. And then on the provider front, the provider credentialing, a great time to really work with our payers to accelerate the completion of the credentialing process. Certainly in good times, we don't want for that to be delayed, and we don't want to have claims denied because a provider was not fully credentialed, but really modifying that workflow, working with the payers to streamline that process, and making sure you have the right either system in place or the right process to monitor the effectiveness of that. And then, denials management, I think, is a piece that we also help clients with. Of course, it's, good times and bad, but it's certainly an opportunity to double down on that to understand, how can we make sure that the staff that may have some free time are digging into those issues and root causes and doing some fixes to the root cause of the items, whether it be a system or a process breakdown. So improvement checklist here, next slide. Yeah, this one right here on the improvement checklist. Most of these I spoke to. That first bullet, really understanding the cash collection targets I mentioned, were really understanding the impacts to cash in the future. And of course, the rest of these I think are fundamental revenue cycle tasks of just understanding how can you now look at this in the new environment. So whether it requires an overall assessment of your operations end to end, or particularly just in one functional area, certainly some time that we recommend and we're helping clients review to make sure once volumes come back that the process is even that much cleaner. And of course, with this, the fundamentals, goals, the accountability structures, and the regular review of that is key. And that goes really for whether it be a revenue integrity improvement process, a denial management, et cetera. You're going to need a coordinated effort across the revenue cycle. And the teams that we're helping out with, of course, you on the phone, really taking a leadership role in that. So with that, I'll pass it on to Scott.
Thanks, Brian. Hello, everyone. This is Scott Pelletieri. I wanted to cover technical optimization a little bit differently because, as you can imagine, each area that we've discussed to date, telemedicine, virtual business office, each one of those respective areas, of course, have a technical optimization component. So I wanted to look more at technology and where it stands today and help guide on just some guiding principles that I think will help ensure your success as you go through this rapidly changing environment. So next slide, if you don't mind. First thing that I wanted to emphasize, and I've given some examples here that I know you've already heard from Brian, but operationally led IT change. As you're developing your plans and what needs to happen for the revenue cycle, and as you're shifting resources between whether it be back end to front end or wherever the work effort is needed, there are going to be very quick changes that are going to be needed to your systems, to your work queues, to make sure that the staff is able to effectively and efficiently work the accounts that they need to work. Two other suggestions I have put in here that I think are important is, given that this is a constantly changing environment, I would implement daily huddles within your revenue cycle to talk through what's working from a system standpoint, what's not working, where are there training issues, and how can you make sure those issues are being addressed quickly. And then also making sure that you have a good group of super users who are able to provide, probably right now, more of a remote support, but a way for them to guide your teams as they are trying to work through these changes in these accounts. So my key takeaway here, operationally led IT change. Revenue cycle needs to be driving the changes that they need. Next slide, please. So another piece of this too, what I've seen in the industry since really the beginning of 2019 has been a slowdown in your typical EHR or revenue cycle system implementation. Now, I'm sure there's some on the phone that are still going through some sort of implementation that may be paused, but for the most part, organizations have really gone through that function and are now more in either an optimization or a using the system type stage. I believe right now that given the changes that we're seeing and the real-time impacts this is having on the technology, we almost have to go back to a governance and a project management structure that was in existence during your original system implementation. So I believe most IT departments now are in more of a support function, but with the rapidly changing environment and rapidly changing system requirements, I would say we almost need a very similar type structure within that IT organization, including both a steering committee and an overall governance structure, but even the best practice processes around, are we creating project work plans? Are we doing the appropriate status reporting? What's the sign-off process and acceptance process to make sure that the system changes are working appropriately? All of those key, what I would call best practice IT project methodology or management strategies, those need to come back into play. So those would be good conversations to have internally with your IT leadership to make sure that they are setting themselves up to really respond appropriately to the initiatives that you're approaching them with. Based on your, it's being led from an operational perspective, they need to be ready and capable and able to respond to those respective requests. Next slide, please. So I've already touched on some of this, and I put the telemedicine, the virtual business office, and the call center off to the right because those are the technology piece to this really impacts each of those in almost the same type of way. And the theme that I have put here is it's a rapidly changing revenue cycle. There is new functionality coming out. There are new compliance or rules, billing rules, et cetera, that's coming out that need to be implemented quickly. And for each of these respective areas, you have to have the ability to get those changes into your systems quickly. As I've already touched on the staffing changes and the work queue pieces, you're going to need to make sure that your work queues are managed, you're not creating black holes, and that honestly you have the right staff aligned with what those accounts are that need to be worked. Anytime you have a staff changing, there's going to be security changes. You're going to have to make sure that you're tracking and holding those individuals accountable. So you're probably going to have the need for reporting and dashboard changes or revisions. And then I also recommend now's the time, especially if you have some sort of data repository or data analytics system that sits on top of your revenue cycle data, is to start running some what-if scenarios to try and understand where there's specific opportunities and things that you might not just be thinking of, given the fact that it is changing so quickly from both a compliance as well as a regulatory standpoint. So these are just examples, which I think, really stretch across each of the respective services on the right, but are things that are going to come into play as you're looking at each one of those respective new functions and or tweaking of an existing function. Next slide, please. Another area of opportunity from a technology standpoint, and Brian had touched on this in some detail, but it's really just tracking the impact of COVID. There's going to be the need to create custom reports or custom account pools so that you're understanding what your fixed and variable costs have been associated with the COVID-19 pandemic. You're also going to want to understand what's happening from a revenue standpoint. I do think it will be of value to track all of your cases, and I have this specific to COVID-19, but in reality, if telemedicine is new to your organization, that's another account population that I would like to, I would recommend tracking at a very detailed level, as well as anything new that's coming into the organization or anything new that is a compliance or a regulatory change that you need to make sure you're getting right now and understanding what the implications are of those respective items. So you're going to have the opportunity to either create specific reporting, to modify dashboards, and to really make sure that you're keeping a very, very strong pulse on exactly what's happening with those accounts. So you're understanding both reimbursement as well as what the organization has done in regards to those items to ensure that you're in compliance with the ever-changing regulatory requirements that are out there. Next slide, please. Technical optimization. So I also looked at this a little bit differently from an accounts receivable reset. And this one, I understand may be a bit of a challenge given the fact that a lot of organizations have had to furlough some staff. But I do believe as you have had declining volumes, and as Tim had mentioned at the start of the call, some patients are still a little leery in coming back into a hospital setting. So with that being the case, there is a bit of a downturn right now. And if you have the receivables, now's the time to really put a heavy focus on the accounts receivable. And I titled that an accounts receivable reset. So now I would call them special projects, call it creating custom reports or setting up special work queues. Now's going to be the time to start taking a look at some of those respective troubled accounts or problem payers that just haven't paid in the past to see if you can start to get resolution. And it's also an opportunity for you to start looking at what some of the, I would call them bad revenue cycle practices, or just some of the things that have not worked as well in the past that has resulted in delays in payment. Now's the time to get those items fixed as well, from both a technology standpoint as well as a people and process perspective. And then I've already touched on this last one, but it may also be or provide you an opportunity to be able to start talking with managed care payers, doing some of the negotiated settlements that Brian mentioned on old accounts receivable, areas that you know had been underpaid, or any other account population that you believe you just have not been reimbursed, not being reimbursed fairly on historically, to try and help cash flow at this time. Next slide, please. So shifting then from technology optimization into vendor partnerships, I broke vendor partnerships into really three different areas. There is the extended business office. So from an extended business office, this could be anything from the early out self-pay vendors to bad debt collection vendors, or to simply a true extended business office, having a vendor there who is able to help work extra accounts while you potentially may still have resources either furloughed or just not back up to 100% productivity. And the outcomes, of course, here associated with this would be the opportunity to accelerate cash, which Brian already covered, net revenue improvement or new cash. And then there may be the opportunity to reduce cost to collect. If you're if you have resources that have been furloughed, but you're able to get a vendor in on a contingent contract, there may be a way there to actually have a fairly low collection cost ratio for the dollars that respective vendor is collecting. Now, what I hadn't noted here, but I think is also important, is you also have coding vendors. You have vendors who can help from a CDI perspective, underpayments, et cetera. So those are additional areas to consider as you're looking at staff and how fast you're able to bring those individuals back into the organization, just to make sure that you aren't creating backlogs as you're ramping back up within your respective group. The next area I have listed here is financial services. And what I mean by financial services is I have seen a trend in a lot of communities where there are organizations, local banking institutions, that are starting to work within the healthcare organizations to offer a credit plan through that respective healthcare organization or provider. And so if your organization is not doing that, I've actually seen a lot of really good success between the partnerships with the banks and the healthcare institutions to collect additional dollars. These, of course, are self-pay dollars, but as you know, our unemployment rates are going up significantly given COVID-19 and the pandemic. And I do believe self-pay as a part or a portion of your payer mix is going to continue to grow, at least in the short term. So something to consider there that may help drive additional cash. And then lastly, what I have noted under financial services is accounts receivable options. We had already touched on the things you can do internally on how you can possibly collect those dollars, but there are organizations out there that are also willing to purchase accounts receivables or portions of the accounts receivable at a high percentage on the dollar that then allows for certain resources to be freed up and focused in other areas. So just another financial services opportunity that is available to healthcare and that I have seen active here recently. And then, being technology focused, the last thing I wanted to focus on here is, of course, technology partners. If you have the opportunity for automation, and whether that be through robotic processing or RPA, whether that be through a new tool or new functionality, now is the time to start looking at whether or not those technology partners can come in and provide a strong ROI based on some of the things that you're seeing. I also believe it will be important, given that the regulatory requirements seem to be changing and there seems to be updates almost on a daily basis, having a good charging or billing compliance solution in place will also help mitigate some of the risk of accidentally billing incorrectly as these rules are changing. So with that said, I will hand it over to Mindy, who will cover kick off the access strategy in telehealth.
Perfect. Thank you, Scott. Next slide. As we know, COVID has been an unexpected disruptor for many of our healthcare organizations. And to help us plan for the future, I have provided, or I am discussing, a list of questions to ask today to lay the groundwork for tomorrow. From a strategy perspective, the first thing is, what does our digital health platform look like today? And are we offering telemedicine, virtual visits, and e-visits for all specialties allowed? As we know, with the COVID emergency state, Medicare and Medicaid, as well as some of our commercial providers, are relaxing some of those regulations, and additional specialties are now being allowed to provide telemedicine services. In addition to that, we also know that there are other provider levels who are also being allowed to participate in these virtual types of telemedicine visits. A third question to ask when we think about the strategy to lay, or to think about today for tomorrow, would be, how are we reaching out to our patients, and are we converting visits to the digital platform effectively? One thing that we have heard from our clients recently is that they looked at all of their patients who were scheduled, and they created a triage platform to identify patients who could be converted to a digital visit at this very moment, or do these patients need to continue to come into our organization, and how are we reaching out to them to ensure that they are comfortable still coming into our facility? Fourthly, are we reaching out to the broad community and attracting new patients? So this goes into the future. What are we thinking about today to set us up for success tomorrow? From an operations perspective, one thing to think about is, does our physician group have the digital tools and accessibility to complete digital health services? Have we also reevaluated the digital patient access workflow to ensure patients are arrived and providers can document the encounter timely and efficiently? Something that we've heard from our clients as well is that providers are spending quite a bit of time helping patients connect to the digital platform. I think that this could have been something that was a bit unexpected. And as a result of that, we may need to buffer in some additional time for our providers in the short term to allow for some of that digital connection. Thirdly, does the operations access team have the training to virtually verify insurance and collect other patient data? In the previous state, we had several access front desk team members physically collecting some of this documentation. However, what do we need to do to ensure that we are still collecting all of this information timely? Lastly, is patient accounting ready to proactively monitor claims, denials, and underpayments relative to the quickly changing regulatory requirements? An example of this could be, does your revenue integrity team have a list of all charges that can be billed relative to each respective insurance company that you're contracted with, that mirrors your contractual terms to ensure that claims are sent out and paid accordingly? With that, I will pass it over to Yolanda. Next slide.
Thank you, Mindy. So as Mindy just laid out is why we're here and how we got here, and some of the things we should be looking at both short-term and long-term as you are developing your digital health strategy. What we wanted to show you was the roadmap that we were looking at in asking questions around, as you've done this and stood up telehealth services very quickly, and given the pace didn't leave time to really architect things in a way that probably would have built in more efficiencies. It's time to just step back and look at, did we do this correctly? Is it done in the most efficient way? Looking at it from both access through delivery of care, all the way to reimbursement. And as you add other digital services, these are some of the areas you want to be looking at to make sure that those services are brought in with the same thoughts around making sure that you've got the efficiency there built in, both for your employees, for the patients, as well as for your providers. Next slide. So what I really want to get to is share with you our checklist as you're thinking through and developing your digital strategy. Wanted to share with you our checklist around how to stop and reevaluate what you did and see if it is doing what you needed to do. So access is one of those areas that's really big. And Mindy just touched on quite a few of those items that would be helpful as you're thinking through access. So how are you connecting with your patients? Are you looking at expanding the way you connect with your patients? So not just within your patient portal, but also how do you connect with your patients outside the portal? How are you doing intake, standing up your telemedicine services? You know, your staff are no longer in office filling out those forms that you normally would have filled out. So how are you able to capture those forms electronically and capture electronic signatures or any type of questionnaires that you would have had the patient go through prior to seeing the provider? So it's really looking at how are we doing those things, and can we do them differently, and can we truly get them all electronically? And then from an operations and clinical perspective, looking at how are you your workflows working for your providers, and are there other services that you can deliver through telehealth or digital services? Education, how are your providers being educated? And not just your providers, but also your staff that are now remote, working from home, doing registration and financial clearance and other functional activities. And then the third one is a platform and infrastructure. So how is your infrastructure set up? Are you able to support expanded services currently? What is the integration of your systems? So if you had to implement, but you weren't able to integrate those systems so that it can work more efficiently for your end users, what are the possibilities to be able to do that now and make this something that you can certainly build off of in the long term? And then the revenue cycle processes, looking at your workflows, your processes, your policies and procedures, how they've changed as it relates to telemedicine. Your access and financial clearance functions, are you able to leverage more automation through things that you normally would have been doing by a phone? Are you able to automate some of those things that you're doing with payers? Documentation and coding, making sure that the coding is correct. If you've started billing, being able to make sure that your documentation is correct by evaluating your denials or just evaluating how you were paid. Mindy touched a little bit on revenue integrity and billing and denial management and reimbursement. So the last one is really walking through your operations review. Again, looking at all the possibilities of being able to disseminate education and training to your folks to be able to quickly scale as you need and as you add services. Also looking at your staffing and your resources, can you shift them around? So by being able to quickly educate them, you'll have the opportunity to better utilize your resources. And then the last one I want to touch on in this section is your patient communication, the patient experience, looking at the patient experience through this entire process. Standing this up very quickly, we obviously have the advantage that now patients are much more open to telehealth services. So there's a starting point to be able to say that you can build upon to be able to expand those services. And as Mindy said, looking at types of appointments that perhaps in the past have been people who come in for face-to-face interaction, but maybe now those types of appointments can be moved to more of a virtual care service. So there's certainly opportunity here to really evaluate how your patients are responding to your telehealth services and what can you take from their feedback to perhaps even further enhance and improve their experience. I invite Mindy to add, or even Ian to add anything else if they'd like as it relates to telehealth. So then I think, Rebecca, if there's any questions, I will turn it to you.
Yeah, excellent. This is Tim. I want to say Just real quick, thank you to the team. I appreciate you guys sharing your on-the-ground experiences. Really helpful as we continue to progress through this. And as Yolanda said, at this time, Rebecca, we'll open it up for any questions that the group may have or anything that has been submitted during the duration of the webinar.
We do have a question. As it relates to the business office, which revenue cycle functions do you see needing more support?
Hey, this is Brian. I can probably take first crack at that. What we've seen is, I think I touched on this a little bit, is really those patient access functions, so particularly scheduling and financial clearance, so insurance verification and authorizations. Those have been, one of the first to kind of scale down because of the decrease in visit volumes and overall associated revenue. And as those come back, now we're seeing that the claims have been caught up, and we're having to really not only fill the scheduling blocks for what we'd see normally and 4 or 5 weeks out, but the immediate term. So as soon as a couple of days from now, we're looking at that type of time frame where all of a sudden providers are coming more online. Yes, we've had telehealth visits, but we're looking at procedures. Can we get ORs open back up and filling those slots, really in short order. So we're having to shift. And what we've seen some clients do is really retrain or bring those billing teams or back office teams up to those front end functions and supplement them because they're being a little bit overwhelmed as folks are trying to open up as quickly as possible.
The other thing I would add, this is Tim, Brian, is I think the coding and billing component as well is going to need some attention. And I think it's been interesting as we've monitored with our federal team every day. There's a change in a funding mechanism, a guideline for reporting into the future for that funding. And the revenue cycle has to react very quickly to that. So you look at HRSA and you look at, what is now reimbursed that would be self-pay related to COVID. So you have to track that appropriately. You have to make sure you have, the right, if you will, coordination of benefits to get the right payer to maximize. So I think that's a challenge and just something we need to continue to keep a pulse on because of the change. At more of a macro level, it's interesting because you look at places that are handing out the funding, such as FEMA and some of the other government entities. They're used to dealing with natural disasters, and while this is a disaster, it's ongoing. And again, we're seeing more rules and regulations every day come out. So I think coding and billing is another one we just have to keep a pulse on very closely.
Thanks, guys. Another question: how do you recommend approaching commercial payers for payment advances, and have you seen that be successful?
Tim, it's Ian. I'll take that if you like.
Sure.
We have put that out there as an optional thing to consider. I have had good conversations with a number of large payers about doing so. The big business concern is we don't really know what our volume is going to be, and the ability for us to kind of track AR and work it against funds that we've gotten. It's kind of like getting a really large credit balance and then having to work down, future claims. It's difficult sometimes for your systems to work those things. So I would probably consider that more as a last resort and not want to work it against AR, but to get it from a liquidity perspective, to maybe if you have such a large payer and a partner, that you could sit down and work through what some of the options would be, not have it be so commingled and tied to future state AR, because we just don't know when our volume replenishment or our volume replacement is going to kick in. But we've had some good conversations that if we get into a pinch, some of the payers are willing to give us some dollars to help make some payments. But it is fraught with concern, and you've got to weigh all those options.
Thank you, Ian. Another question: how do you balance the self-pay collect process while trying to be sensitive to the current environment with so many people on more of a fixed income or experiencing job loss?
Hey, this is Tim. I can take that one, and then Ian and Brian, you guys can hop in as well. A lot of the clients I've been speaking with over the past week, that is the right question to ask. There's a sensitivity level and a heightened sensitivity there. What we've seen is more activation around the payment plans. If there's zero interest payment plans that a hospital can offer, if you can extend your deadline for the payment term, any little thing from a financing or payment terminology perspective has been helping, and we've seen kind of that move on the self-pay front as well.
Yeah, I've delayed having accounts continue through the dunning cycle, so they just kind of stay in the spot where they are in an effort to not send folks to collections. But it's a real interesting data point. 40% of the people who went on unemployment were kind of low income, and most of them have done better, albeit not all of them have gotten their checks yet through the unemployment portals. But we had our best self-pay month last month that we've ever had, and we believe that it has to do with the folks that are continuing to receive unemployment benefits, and they do seem to be paying their bills. We have held back on moving them through the cycles, but we have not seen a significant drop off in actual payments, and believe it has something to do with folks having more funds maybe on unemployment than they would if they would be working. So more to follow here in the next couple of months, but it was an interesting development.
Thanks, guys. There are no additional questions. Tim, do you have any final comments?
No, I think I would just like to thank everybody for your time. Again, we will get all material out to the audience here. We have our website set up specifically. And as always, if you guys have questions or need more specificity, please let us know. If there's any way we can help you with any of these in terms of execution, be happy to set up some time and provide some more information. So again, thank you for your time. We hope everybody stays safe and healthy, and talk to you soon. Thank you.
Thanks, Tim. Thank you for joining today's session. We would love to continue to hear from you. Feel free to reach out via the contact information on your screen. Thank you to our presenters. You may now disconnect.